provision. Thank you for everything you are to us. God, we say thank you. We've come again to say we love you.
Hello, everybody.
Thank you for how you love us. It's unreasonable. It's unimaginable.
God bless you all.
Bless your name, Jesus, for remaining
This is not a
consistent with
preaching
us.
message. This is a message to
We gather together again all over the world.
healthcare workers in
To
Liberia.
say thank you.
Please share if you know
Even when
a
it
doctor,
looks like things are not
a
working with
nurse,
us,
anyone
you know
that
you're
works,
right there with us.
anyone that works in
We come
the
to you because every plan, the thoughts, and
healthcare
purpose you have
sector.
for us
I'd
are
like you to
good.
share this to them.
And that remains our confidence in you. Take all the glory in all of this.
This is not a hate message.
Amen.
This is not a drama message. This is a loving message.
Hallelujah.
Thank you, Jesus.
Hallelujah.
So please share. Please share. If you have a friend that is a nurse in Liberia, if you have a doctor in Liberia, like I said, if you have anyone that's affiliated with the healthcare sector in Liberia, this message is for them. This is a loving message. As you can see under here, this is a loving message. So I'm going to give it 5 minutes to share with people, to share with others. I don't know if I'm loud on here. I'm going to test this to see if I can hear myself, okay? I'm going to test this to see if I can hear myself, okay? Okay, it is clear. Please share. When it's 5 minutes in, I will start. Like I said, this is not a hate message because I know we are known for hateful messages. When it comes to degrading each other, we share that. When it's something bad, we share it. When it is toxic, we share those things. But this is not a toxic message. This is not a hateful message. I just wanted to speak to my fellow healthcare workers. I just want to say certain things. So I'll wait 2 more minutes. Please share. This is not preaching either. This is a nurse to a fellow co-worker or colleague. This is just a loving message. I have 1 more minute. You can share this because I'm pretty sure this will be very helpful to us, to Liberians that are working in the health sector in Liberia, to doctors, nurses, CNAs. I don't know if we have seen this in Liberia, but I guess we do. We should have seen this in Liberia, but probably it's not called CNAs. Okay, I'm gonna do a little introduction. I am Princess Moore Johnson. I was born in Liberia, Monrovia, Liberia, May 16, 1982 at the Maternity Center in Monrovia. I left Liberia when I was 8 years old. I went back there after 8 years. I went back there in 2011. And then after that, the next time I went back there was 2018, 2020, 21, and so forth. So have had a couple of experiences in during that time frame in Liberia. And I love Liberia. I just love my country. But today, what I have to discuss today is gonna be a sensitive topic to some Liberians. It's gonna be very sensitive because usually when you speak the truth, others take it as offensive. Others take it very personal. Some people don't get the logic in it. They run for the negative aspect instead of seeing positivity in the message. So this message, like I stated, is this a loving message. It is not coming from hate. It is not coming to degrade anybody. It is not coming to belittle anybody. It is just to educate us about certain things. Sometimes we do not know how bad certain things are until the outsiders see that. Sometimes we don't know we are doing something bad until somebody else sees that it's bad, and then you realize that what you did was wrong. So this message is actually about some of the things that are done in Liberia that are not okay, that we could improve on, that will actually benefit our country. I am a nurse by profession. I became a nurse in the United States of America. I went to school here. I went to high school. I'm gonna be back and forth because I have a baby that is very active. Just threw his bottle to the floor. Let me give him this bottle. Didi? You gotta be. Let me put your shoe on. Okay. All right. So, like I said, I went to school here. Let me put your stuff on. Hold on. So I went to school in the United States. I went to high school here actually, and I actually went to school in Ghana and the Ivory Coast. I went to school in Ghana. Oh, let me put your stuff on. I went to school in Ghana and I went to school in Ivory Coast. And I went to St. Mary's for a short period of time. So I don't know how the education system is in Liberia. But when I was in Liberia, I went to the Hilton Van E. And that was that. Let me put my son's let me put something on so he's not distracting this video. Okay, so I went to school there and here as well. And like I said, I'm not here to degrade anybody. I'm not here to belittle anybody. This is not a hate message. This is a loving message. And I became a nurse because of the passion that I have for caring for people. And I'm going to give some instances of what I feel is lacking in Liberia. I'm also going to talk, we cannot compare. I know some people would say do not compare the United States with Liberia. Some might say Liberia is different. But in order for us to develop, you have to see what you want to be and run after what you want to be. So we have the mindset that because you are not from Liberia or you don't live in Liberia, you have no say in what happens in Liberia. And I think that's what has a lot of us are living behind. We are living like we are not updated to certain things because we refuse to open our minds to new things. We are stuck in our ways. And I will give my example before I start to speak. Before you become a nurse, there are certain reasons why people become a nurse. I have a passion for nursing. I wanted to be a lawyer at first when I was back home. When I was in Ghana, I wanted to be either a lawyer or a nurse. When I came to the United States, I applied for both. I got accepted both ways, to become a nurse or to be a lawyer. But there was more passion towards nursing than the law. So that's why I drifted towards nursing. Now the reason of this video, I've been wanting to do this for a while. I've done some before, but the reason of this video is that a lot of things are going on in our health system, like Liberia, the hospitals. And I don't know if we know that it is affecting our country, but for us that are outside, when we hear certain things, I'm a Liberian. I'm also a United States citizen, so I'm an American as well. I work with not only Americans, I work with Nigerians, I work with Ghanaians, I work with Sierra Leoneans, Kenyans. I work with a lot of West African citizens that migrated to the United States. So I listen, I observe, and I pay attention to certain things. Now we're going to talk about being a nurse. I don't know why nurses become nurses in Liberia. I don't know if it's the passion. I know in the United States we have two kinds of people. We have people that go after the money, and then we have people that actually love nursing. And those that go after the money, we know them at work because they are not thorough when they are working. They are not patient. They don't have the passion. They're just there for nursing. They're just there to get the money because nursing pays a lot in the United States. The income for nurses are very high. So a lot of people find it, better to become nurses, but they don't have the passion. So I don't know why people became nurses in Liberia, but I'm just going to talk from my experience and from certain things that we need to do in Liberia to help our system in Liberia. As a nurse, you have to be accountable. You have to be respectful. You have to be compassionate. You have to be caring. You have to consider your patients as your family members, as yourself. Will you talk to your patients the way you talk to them if the tables were turned around? If you were the patient, would you want to be spoken to in that manner? No. And the reason why I'm talking about this today is that I've had a couple of conversations with my fellow Liberians who are nurses in the United States. I have had conversations with doctors in the United States. I have had conversations with nurses who are not Liberians. I've had conversations with doctors who are not Liberians, and they all have the same issue with Liberians in Liberia working in hospitals, taking care of people. It's like the complaints are almost identical. My thing is to us, I was I know somebody will say you don't live in Liberia, but I was in Liberia. I got sick in Liberia, and the way I was treated wasn't right. And when I got to the hospital, I was not dressed like an American. I was stressed out. I was actually going through a miscarriage. You okay? You okay? I was actually going through a miscarriage. So when you are in pain, you are not going to look your prettiest. So I didn't have a wig on. My hair was messy. I looked strange. You understand? So I went to the first hospital. I was bleeding. And when I went to the first hospital, they rejected me. According to them, I did not attend prenatal I did not do my prenatal care at the clinic or the hospital, so they could not see me. That right there was a red flag. I was upset. But that kind of struck me like, wait, this is a hospital. It is just like a church. People go to churches, to see God for prayers because they need deliverance, they need help from the church. So if somebody goes to the hospital, it is because they need an emergent care. Now I was turned away because I did not do my prenatal there. So I was sent to the Catholic hospital. And like I said, this video is not to degrade, it is not to bring anybody down, it's just to educate us. We want those of us that are not living in the that are not living in Liberia. I don't know about everybody, but for me, I want to go back home. I want to live in my country. I don't want to be here for the rest of my life. I feel like Liberia would benefit from me. So I'm not here to stay here forever to get old in America. No. I want to give back to my country. So that kind of bothered me when I was sent away. I was sent to the cardiac hospital. And there were certain things that really, really bothered me. A lot, like the first thing was when I got there, they accepted me, thank God, but I was bleeding. The nurse came. There were some good nurses. There were some nurses that talked nicely, but there were some of them that were very harsh, even including the doctor. And I remember I got accepted. They did the checkup. They said I had to pay a certain amount before they could take me in. I'm not upset with that. I don't know how that system works, so I can't say nothing about it. I will wish that one day we would not put money first before helping a patient. We would put money ahead of somebody's life. At least take them in, treat them. If you're gonna keep them in the hospital until they pay you before you discharge them, that's fine. But at least for I don't know the scope of practice. I don't know the vows that are made in Liberia before you become a nurse or before you become a healthcare worker. But for the United States, before you become a nurse, you have to swear and vow to do certain things. Like you put the patient first. That's the vow that you make, to put the patient first. So it doesn't matter who this patient is, you are not going to discriminate. You are going to care for your patient. So I see it differently in Liberia. So I don't know the scope of practice, but I will wish and hope that one day we will accept criticism, we will accept the wrongs, and will work on the wrongs. And my experience when I went to Liberia at that time, when I went to the hospital, was I was very afraid. The bed was very dirty. There was blood on the walls. There was no privacy. The doctor came, did not greet me. I was bleeding, and he said he came with other doctors. Like you should have the etiquette and respect. Even if you have a training, like a doctor that is in training, you have to ask the patient's permission before you bring in somebody else. That's how it is done. For the like the patient's privacy, they have the right to choose who they want to take care of them. So if you have a student doctor or a resident doctor that is not officially a doctor, you don't just bring them up in a room to check me, because I'm signing my rights to you to take care of me, but not somebody else. But this doctor came in. I don't have a problem with the resident doctor coming in, because actually he did do something that I appreciated. But when this doctor came, the one that was the attending physician, when he walked in, he did not greet me. He had other doctors with him. He didn't say hi, nothing. He asked for whatever instrument he was supposed to use to look down there right in front of me. They didn't say nothing. I was so afraid. And he talked to the nurses. They brought him this tray that has some knives, scalpels, like medical equipment on there. And then he had a disinfectant bottle, and he just poured that right in front of me instead of disinfect the instruments that he was supposed to use in front of me. I started to panic. Infection, like I could see infection about to happen. I was shaking. And then after he did that, he didn't say hi to me. The next thing he said was I should open my legs. And at that moment, I'm like, no, I can't even do this. I just freaked out. And I told him, I said, you're not going to touch me. I said, I am a nurse and I've worked with doctors. I've never, ever seen my doctor speak to the patient in this manner. No greeting, nothing. And then he was like, what did you say? He had an accent. I don't know if he's a Liberian. I don't know if he went out of the country to learn, but I could tell you that he had an accent. And there was this white doctor. I think he was a doctor in training, or he was doing his residency or orientation there, or clinicals or whatever there. So the guy told him that she said, do not touch her, that you did not greet her, and you cannot touch her. She's a nurse. She's not from here. And all of a sudden, this doctor became calm. He apologized. And he introduced himself to me and then told me what he was going to do. And at that moment, I got comfortable. And when I got comfortable, I allowed him to do what he had to do. And he told me, he said, we'll have to take you to the OR to do a DNC because you've dilated and the twins are coming out. So I was like, okay. So they took me in and they were about to prep me. Another thing, the room they were supposed to prep me in, no privacy. People were just coming in and out. My legs were open like nothing. Like people just, there was no blanket, no towel, nothing to cover my private area. I was just open up. And I told them I wanted to pee. So I think they were going to bring something. They wanted to give me, I don't know if it was IV or something to sedate me. I don't remember because I was still in the panic mode. But they this guy came in, like, no privacy. My private area was just open to everybody. And they did what they had to do. They did the procedure. I After the procedure, they sent me in the, where those people had their babies because I was pregnant. So I went to the maternity ward. So I had to go to the recovery section. Although I didn't have my babies with me, I was there with other mothers. And I remember a nurse came in, did not ask me for the next day because I was, the first day they had to sedate me because I was in shock. So that day I slept all through. The next day, the medicine started to wear off. So the medication started to wear off. And as this nurse came in, did not say hi to me, came with her little book and there's some medications. And she said, I'm here to give you a shot. And I said, what shot? She was so upset, could not even explain to me what the shot was about. And then she gave me this name. But me knowing I'm a nurse, I'm like, that's not for me. I know certain medications. I might not be where I want to be for now, but I know medication. So I told her, I said, that is not mine. And she went off. Oh, it's you. If you want to take it, let me go for you. I got time for this. I gotta go to the next person. So I said, that's not mine. She said, oh, in for you. So she took the book, the sheet, and she called the name out, whoever she was supposed to give that shot to. And I said, that's not me. My name is Princess, as I was married to my ex, so I gave my last name. And she said, oh, don't you? Then she looked at the door and then realized she was in the wrong room. She had the wrong patients, wrong room, wrong medication, everything. And she just walked out and left. That was a concern to me because a lot of people in Liberia are dying. because of the negligence of nurses, because they don't care. We are not doing a thorough um we are not doing a thorough um right what we're supposed to do before you give our medication. We don't do that. We just, I don't know. So she left, and after she left, then I realized that when I started to get better, I stayed out a few days, and I started to get better. And then I started listening to other patients that gave birth. I was asking some questions, and some of them started to tell me that when you go to give birth, the way the nurses speak to you is very humiliating. They talk to you anyhow. Some of them will tell you, open your leg when you're having sex. You are open your leg and push the baby out. Do this and do that. That's very degrading. That's not being compassionate. When you vow to be a nurse, you are there to take care of this person's life is in your hand. They are coming to you because they trust that you will take care of them. They are coming to you because they believe that they will be well. They are not coming for you to scold them. You are not their parents. They are not coming for you to humiliate them. They are coming because they need your help. And it is the responsibility of a nurse to take care of the patient. Doctors do not take care of the patients. The doctors are there to diagnose and to prescribe. Nurses are there to treat. If you need Tylenol, the nurse is going to give you Tylenol, paracetamol, if that's how you all call it. Devin, come on. So the nurse is there to give you paracetamol, whatever you call it, antibiotics, whatever it is. The doctor does not spend the doctors does not spend time with the patient. Doctors spend, I would say, roughly, if they stay 5 minutes in a room with you, that's okay. Some of them go for a minute or two, just to ask few questions and they are out. It is the nurse's responsibility to spend more time. So that's what we do. That's what. Give me 1 minute. Let me get my son. So it is the doctor's responsibility to just check, prescribe, or whatever. But as a nurse, it is our responsibility to make sure patients are well taken care of. It is it is our responsibility to make sure that our patients don't die. Now, the reason why I'm getting to another point is that if you do not have compassion for your patients, for those that you are taking care of, why become a nurse? If you don't have integrity, and when I say integrity, Liberia is suffering right now because there are a lot of nurses that don't have integrity. They are not honest. A lot of nurses steal the medical supplies from the hospitals, from wherever they work in, they steal and have their own practices at home. And the reason why I'm saying this because I've been in a situation where I was sitting somewhere and somebody's friend was a nurse in Liberia, and this person had malaria, and the person said to them, okay, I'm coming when I come home. I need to take some stuff from you. When I come home, I will treat you. Like, you are treating out of the hospital. That's dishonesty. That's stealing. I'm not here to hate on nobody, but I'm just saying if we work together, if we are honest in Liberia, if we are honest healthcare workers, I know Liberia is hard. I know Liberia is very difficult and we are trying to survive. But if we do what is right and be honest, I'm sure our healthcare system will go up. The reason why I'm here today is because there are so many ways that we could get help in Liberia. There are so many opportunities. I'm a nurse. I know a lot of people. I have connections with people. Like I said from the introduction, I know nurses, I know doctors. I know people that will want to help Liberia, but because of our dishonesty, because we are not faithful, because we are not loyal, because we are not, we don't have integrity. There is no accountability. You go to work and you are stealing the medical supply to go home to treat somebody at home. That's stealing. Being a nurse, there's an oath that you take to care for your patient. You did not purchase that. Why are you stealing it to go home to take care of somebody at home? Why? People want to help. I've spoken to nurses. I want to build my hospital in Liberia. My brothers and I we want to build a hospital. Besides us building a hospital, I'm working on building my clinic because I want to give back to my country. Liberia needs help. A lot of us are in the United States. I don't know about everybody, like a lot would like to go home one day. But when you sit and talk to other Liberians that have the capability of helping Liberians in Liberia, they don't want to because they try a few people that were very dishonest. And because of that, you people are making others like you are blocking ways for others to receive the help that they need. There are so many programs for Liberians to tap in. The Kenyans are tapping in, the Nigerians are tapping in. Do you know that nurses can leave Africa and come here and get some training? Do you know that there is a program that can get nurses from Africa to come to the United States, improve yourself, and go back to your country? But because of this honesty, even our country, we are suffering in Liberia. We're suffering. And if somebody wants to help you, so even come here, nobody, I'm for sure. Like I said, I don't want to live in the United States for the rest of my life. I'm working towards coming to Liberia to live. I'm gonna be a doctor one day. It's just a give back. Because my knowledge, I'm here, I work, people appreciate me here. And I just feel like if we have 100 of us leave the United States and go to Liberia, do you know what that would do to our country? Do you know how painful it is when some of us sit here among other African people that are not Liberians and they talk down on us about how terrible we are with our health system, how we cannot be trusted. Do you know how humiliating it is when people say those things? And some people want to help, but they can't help because there is no good news coming. People send medical supplies and you steal it. People steal it to do their personal things. Like people working in hospital, you stealing the medication. There is no medicine. Even the governments in the United States, I'm not talking about Liberia, in the United States, there are organizations that want to help. I'm in touch with some organizations that will want to help, but people lie, people cheat. Like they donate to these big hospitals in Liberia, and then the doctors and some nurses steal the donation and take those donations to their homes for their personal gain. Instead of helping the Liberian people, they use it for their personal, so they start to sell those things. There are so many programs that people are benefiting from. The NCLEX, is an exam that we take in the United States. Before you become a nurse in the United States, you have to take the NCLEX. We call it the Board of Nursing. And you don't have to come to school in America before you can take the NCLEX. You could take it. There is a program for nurses to take it. You could even come. There's a program that I want to do, but I have to trust people. I know doctors here that will want to help me because I always talk about my country. I always talk about Liberia. When I'm helping, they tell me, "Oh, Bob Princess, why don't you go to school to do this and do that?" I'm like, "Yeah, when I go to school, I'm not working here. I'm going back home." They ask, "Why do I want to go back home?" That's where I'm from. I'm not from the United States. I am I'm a U.S. citizen, but I was not born here, and I want to help my country. But because of how we are not honest, we are so dishonest. People don't want to help us. People don't want to help us. I'm talking about the health system because I work as a healthcare worker here, and one of the problems we have in Liberia as nurses or health professionals, we don't like to take criticism. We don't like to learn. We look at we don't like to take criticism. When people go back home to help, we think they want to take our jobs. And because of that, a lot of us are just back, like we backwards. When somebody goes to Liberia, you think they want to take your job. They want to take your position. You don't see it. You don't see it as something. Let me benefit myself. Let me learn. We look at it like, oh, there's one. They won't want to take my spot here. They won't want to take my position. They to do, and we start to do evil. We go to medicine men to try to stop the person or to block the way. Instead of us looking at this person to be someone that will come and help to benefit, we think they want to take our jobs. I remember during COVID season, there are some of us that really love Liberia. It is not about the money. Some of us really do love Liberia. It is not about the money because Liberia cannot pay us what we make here. Liberia can't. I remember 2020 during the COVID season. During the COVID season, I went to Liberia. I actually went for a funeral, my ex in-law's funeral. And when I went there, it was COVID time. The Americans were bringing back their American citizens. But that was the opportunity because I always dreamed about giving back to my country. I always desire to give back to Liberia. I always desire to help Liberia. So this was the time to join others to educate my fellow Liberians about COVID. My ex was very upset that I was in Liberia at that time because there were nurses in the United States that were making money. COVID season, they were paying nurses a huge amount. A week for my career, nurses were making $6,000 to $8,000 a week because they were paying a lot. Some nurses were making even more. So to my ex, why are you in Liberia when this is the time to make money? But I did not become a nurse because of money. I became a nurse because I love to care for people. I find so much joy when I help my patients. I feel so good when I take care of my patients. Even when my patient has a wound, I love taking care of wounds, what we call sore. I love to take care of wounds. I give my all because I want to take care of it and see the end results. I want that wound to heal. So when I'm doing it, I do it with passion. When I'm taking care of my patients, I like even at work. I'm a nurse, but I curl my patients' hair. I curl their hair, I polish their nails because I want them to feel alive. I want them to feel healthy. It's not only about me going to give you medication. No, It's not only about me saying, open your mouth, take this. No, it's not about that. It is about me making you feel better. Because if I was sick, I would want somebody to care for me. I want to feel better. So that's why I became a nurse. But in Liberia, we are so, I don't know if we have this fear that somebody wants to take my job. So I am not going to be open up to them because they came from the United States and they won't come take my spot here. They act like they know so much. I know some nurses that live in the United States right now that went to help. They went to volunteer. But people didn't know they went to volunteer. They were there for vacation, but they volunteered their services. But people started to speak negatively about them in that JFK. They said to undermine them, but this person was a nurse for a very long time. This person could have helped a lot of nurses. Could have told you, like, there are nurses, there are people that I know that even want to take the way we do things here in Liberia, but because our minds are so closed, we are so stuck up, we are so like negative. We don't want to improve. Ghana is improving, Nigeria is improving, Kenya is improving because they embrace those that have left Liberia to improve themselves. They embrace them. Who wants to leave the United States that paying them a lot of money to go live in Liberia? If somebody does that, it's because of the passion they have for Liberia or for their country. So stop looking at them as your enemy. We are not your enemies. I don't need nobody money. When I went to Liberia that time, I lost money. I lost money because a lot of people saved. I had nurses that saved over 100,000 during that period of time. I could have done that, but I chose to stay. The American embassy called me. They sent me an email. We are getting our citizens out of here. They gave me the time flight. They told me to call to check in to leave. I did not leave. I went out with fellow Liberians to educate Liberians about COVID. I even got sick during that period. I wasn't getting paid to do that. I wasn't. I think they either gave us, I don't even know how much they gave us to buy, water or whatever. But they were not paying us nothing. But I was just rendering my service. There were some people that thought I came to take their position. Even during that time, I had offers to work at JFK. But I didn't go to work in Liberia. I went to just help. So my reason is my thing is, let's love, let's embrace others. We are very backwards in Liberia when it comes to the health system. We think we are updated, but the way we do things, there is no accountability, there is no loyalty, there is no compassion. I know a friend that was not well. One time I was in Liberia when the person was not well. And they they kept going to the hospital. According to them, they had malaria. Okay. And I was like, okay. This person went, they gave him prescriptions, I think antibiotics, and was not antibiotics, they gave this person medication for malaria. So the first 2 weeks, they took it. And I was looking at this person and I tried to tell him, I said, you don't look well, like something is wrong with you. And this person got very offended and went back the second time to the doctor or the nurse or whatever it was and came back with more medications. They came to visit me, they were telling me. And then I asked, before they came to visit me, they had called me over the phone to tell me so and so. And I asked him a question. I said, what medicine they gave you? And then, he told me, and I said, but why? I said, did they do blood work? And he got very upset. He got very offended that I asked that question. He said, well, princess, um, this nurse I've been going to for over 20 something years. She's always treating me. And this is to do you actually know so much. Y'all can come for America and act like y'all know so much. So when he said, I was like, oh, sorry. I get quiet. I said, I apologize. I said, but the reason why I asked these questions, I said, you went to the doctor before, you went to the hospital before for a problem, for a condition. They told you you had malaria. According to you, you had malaria. I said, they gave you certain medications to take. You've taken these medications for 2 weeks. And now they are saying from +4, you got +3 malaria. That means the medicine did not work. I said, what if you don't have, what if it wasn't malaria? What if you have something else? He was really upset. So I remember they came to visit me and I saw him, but I didn't want to talk much because he had already told me that I think I know all because I'm from the United States. So I didn't want to offend anybody. I didn't want anybody to think that I am looking down on nurses in Liberia or the health system. So I shut up. But I could see that he was sick. And whenever he was talking, he was breathing different, heavily. He had infection. You could tell he had infection. But according to him, it was malaria. So I sat, we were sitting down and I'm looking. I said, can I come closer to you? Oh, people not come here again, princess or princess or until you started talking. And they were all laughing. And I said, I know you people look at us like your enemy. I said, but looking at you, I'm gonna look at you like a patient. I said, I got closer to this guy. I didn't have to go too close. I just put my ears to listen to his lungs from the back. I did not have a stethoscope. I did not. But you could hear crackles. You could hear fluid in his lungs. You could hear it. It was very obvious in his left lower lobe. Like you could hear it. The other side was okay, but I could hear water. So I told him, I said, you have fluid infusion. And he went off. I said, you got water here. Oh, Princess can talk big. This is how this guy said. Princess can talk big, big things. I went to the doctor. I even went to the Chinese doctor. They didn't tell me nothing. And you hear saying that I got water in my lungs. Oh, Princess, why did I didn't know so much? This guy went off on me. And when he said that, I said, okay, you say you went to the Chinese doctor. Did he listen to your lungs? So what you mean the doctor check me? Want more videos of cute parents? I said, you look like you have an infection in your lungs. He said, I had pneumonia before, but I'm fine. I said, okay. I said, all right, this malaria you're talking about. I said, you've been there, they give you medication for two weeks. And then nothing was taken care of. And I asked you if this nurse drew your blood. You got very offended. I said, well, I'm going to talk to you. Come on, Didi. Come. So I said, I'm going to talk to you as a nurse. Myself flipped too because he was not listening. So I said, I will talk to you as a nurse. When a patient comes to us and they have certain conditions, before the doctor, come on. Sorry, guys, I have a son, so he's yelling. So I told this person, I said, when a patient comes, they tell us what their problem is. Sometimes they don't know. Some of them say they don't feel good. But what we do is blood work. We do CBC, BMP. we do let me really focus. We do a complete blood work to see what the problem is. Now, if this patient has an infection, what the doctor does is the doctor prescribes antibiotics. So we have broad spectrum. We have different types of antibiotics. There are certain antibiotics that Devin, stop. There are certain antibiotics that might cure certain things, but there are some bacteria that are resistant to the antibiotics. That means if you take certain antibiotics, shh, come on, come here, hold you. You disturbing. What's going on? Come here. Come here. You good? Come on. Okay. So there are certain antibiotics that will there are some bacteria that certain antibiotics cannot stop it. Certain antibiotics cannot destroy that bacteria. So the purpose of the lab is to see. So the fact that this guy went to the hospital the first time, they gave him medication for stop Devin. They gave him medication for um malaria, and then you are still sick 2 weeks after, you still feel chills, you still have fever, you still don't feel okay. It is because the medication they are giving you is not the one you're supposed to receive to be better, or there is something else you were probably misdiagnosed. So I talked to him and I said, you have pleural infusion, which means you have fluid in your lungs, in the space, around your lungs. There are fluids in there. And because of that, there is an infection. That's why you are not breathing. That's why you have fever. That's why you feel chills. You are always cold. You're shaking and stuff like that. So he got upset and walked out, and his friends were still there. He said, I got this girl to do. So he left. Yeah. Like the next day, apparently when he left, maybe certain things that I said made sense to him. He called me the next day. He said, Princess, can you follow me to the doctor? And I was like, okay. So went to the doctor. And he said, and I was sitting, I didn't say nothing. I was very quiet. And this doctor came. The doctor came with his stethoscope and listened normally. And when the doctor got to his, to auscultate the lungs, to listen to the lungs, the doctor kept listening to the left side. Like he kept going up, telling him to take a deep breath, kept doing, and I swear I heard crackles. So the doctor told him, you have to go next door right now to do an x-ray. He said, I think you have pleural infusion because I'm hearing fluid in your lungs, especially the left side. And now this guy looked at me and the doctor asked him, why are you looking at her? And then he smiled. And then at that point I was, I'm like, whatever. And then he told the doctor that she told me that I had that. Then the doctor turned to me and said, are you a nurse? Are you a doctor? I said, no, I'm a nurse. He said, you should be a doctor and come and work here because he thought I lived in Liberia. So he said, he said, come and work with me. And I said, one day I will come back to Liberia to live and work. And I said, you're a good doctor. And then he told him, so when he did his x-ray, the x-ray came back, you could see the images, you could see where the fluid was, you could see what it looks like. And then he apologized. But my thing was that this is what we do a lot in Liberia. We look at others that don't live in Liberia as trying to act like we know so much. We're trying to degrade others. So because of that, we don't want to listen to. We don't want to listen to help. We don't want to listen to somebody that might know differently. For me, for us here, we always do trainings. Like right now, I'm training two nurses because they are taking different positions. And one of them is higher than me, but she is listening. She's asking questions. She's willing to learn. Like I'm telling her how it is done this way. So she's listening. And her degree is higher than mine. But she was humble to listen to how I do it, to how it is done. Although she has so many years in nursing, she listened to me and said, why don't you go back to school to be a doctor? And this conversation was even held yesterday. She said you should go back to school. So you're very smart, you know a lot. Like you just observe certain things. Like I'm learning a lot from you. That's what we're supposed to all do. Liberians, those of us that are working in the hospital or anywhere. Like sometimes I see on Facebook those that are in Liberia are insulting the CNAs here. They call them cleaning poo poo. They're cleaning their poo poo in Liberia, in America. They think they all that. They won't talk to us. I will be in America and clean poo poo. Guess what? I clean poop. I'm a nurse, but I clean poop. Do you know why I clean poop when my patient comes and let's say I'm supposed to insert a Foley catheter and this person poop on themselves? Am I going to call the CNS? Some nurses will call them. I don't call nurses. I don't call it CNS. I clean it. The only thing that I don't do, my CNS will tell you, vomit. I don't go there. Don't tell me to assess it. Don't tell me to look at the consistency. I don't do vomit because I start to throw up. So my CNS know that they don't call me for throw ups. Maybe another nurse will go see what it looks like. But I'm not coming in that room when my patient throws up. I don't do well with vomit. But I clean poop. I'm a nurse. I clean poop. I bathe patients. I have one patient that she loves to take a shower. And when the CNS cannot help her to give her a shower, I will give her a shower. That's my passion. So a lot of I see. Oh God, this is so cool. I see sometimes people talking about CNAs cleaning poo in America, your cleaning poo job. There is a job for everybody. There are people that clean the floor, they clean the maintenance, the housekeepers, they clean the bathrooms. It is a job. But in Liberia, we degrade people in the United States because they're cleaning poop. Even in Liberia, if I have a hospital in Liberia, I'm pretty sure they have CNAs in Liberia that are doing certain things. Or because we don't respect patients, you're not going to clean somebody's poop because you feel like you're so big. You feel like poo cleaning job is not your thing. So you want to talk that I respect my CNAs so much. Let me tell you, I love my CNAs so much because guess what? They are the eyes to the patient. They see their patient every day. Beside me coming to treat the patients, the CNA is always that they give them a bath, they give them showers, they feed them, they comb their hair, so they know when a patient, yesterday they came to this patient to change their bed sheets, and this patient was happy, but today they are there and the patient is not happy. The patient can't even walk. They know there is a problem. They'll come to me, princess. So and so does not look okay. I think you should check on them. And let me tell you, 99% of the time that a CNA will tell me something is wrong with that patient. Because they know that patient is see them every day. So we degrade Liberians in Liberia will post and sell their people cleaning job, insult us in the United States. Oh, because you're cleaning poop in America. I would never go to America and clean poop. Let me tell you something. I know some nurses that were big nurses in Liberia working at JFK, where bosses in Liberia that are in the United States up to today's day, they cannot pass the state board. But they've been nurses for over 10 years in Liberia. Wow, is that? It's not that they're stupid. It's not that they are dumb. It's not that they are slow. No. It's because they are not updated to current nursing ethics, to current nursing education. They are not updated, they are not up to date. So they are in here, they are in the United States, they get past the state board. Because the NCLEX here is everyday stuff. Every year is renewed, every month is renewed. We go through trainings. We go through trainings every month. There is a training for a nurse. We are up to date with certain things. So a nurse that was a nurse in Liberia for 10, 15 years cannot even pass the state board in America. And then when they go to school here to try to go to school, they can't even pass the regular thing here. It is not because you are slow, it's because you're stupid. It's just because that you're not up to date. The way you do things in Liberia is not how it is done here. You people don't even check. You don't even do finger stick. You give somebody IV. You don't even know my auntie died. She had sickle cell anemia and also had an enlarged heart. But guess what? They only focus on the fact that she has sickle cell anemia. They did not focus on the fact that her heart was enlarged. My focus as a patient, as a nurse, will be your heart, because when your heart is functioning properly, you will live. I'm not concerned about your sickle cell. I'm coming after what will keep you alive. Sickle cell is painful. So what I would do as a nurse, probably give you medication to ease the pain, probably give you oxygen, because some people suffer from some patients are hepatic, low oxygen level because of the cell. Normally our red blood cells are round, but for sickle cell patients, it is curved. It's like a sickle. It is sharp, so they feel a lot of pain. So my priority would be for that patient to make sure you are not in pain. But my next thing is, this patient has an inflamed heart, an enlarged heart, a heart that is big. When your heart is big, the heart is a muscle. When the heart is big, that means it has a lot of fluid. It's pumping a lot. Poop, 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 it's pumping. And the muscles start to expand. And when the muscle is like an elastic band, when the muscle expands, when it gets tired, it will pop. It can't expand anymore. It pops. And that's the end. That's how people die, from fluid overload. And that's what happened to my auntie. Although she was a sickle cell patient, she was also a patient that had an enlarged heart. So it was the responsibility of those that were taking care of her to make sure that her heart does not fail. But what did they do? Instead of give her drips. When I spoke to my cousin, she was on her fourth bag of drip. And I told my cousin, I said, tell them to stop. Her heart is gonna fail, she will die. When they went in there to talk to her, my cousin, we had another cousin that is a doctor that was actually visiting Liberia. So let me talk to her, since she knows the medical terms you say, let her tell them. And I was like, okay, before we could get there, my auntie had died. She died. And I know why she died. She has so much fluid in her. The heart gave up. So when we are talking to others, it's not because we want your position, it's because we want to help. And there is nothing you like in America, we call something they call continual education. In order to maintain your license as a nurse in the United States of America, you have to show that you have been educated on certain things. You have to show that you are up to date. Every month, my job, we have healthcare academy, we have reliance, we have education, continual education. You have to know certain things because life is It's an everyday thing. Every day there is a new condition. Every day there is a problem. Every day, like right now, there is the CDC has a new thing now. Before you put on um a gown, before you put on a PPE, you have to have infection, like maybe TB or COVID or certain things. Before you gown up, it has to be a certain infection. But guess what? Now it's not like that. Now they have included into nursing when a patient has a Foley catheter, you have to gown up. Stop it. When they have G tube, anything that is anything that is protruding or anything that is invading the body that will make you get in contact with a bodily fluid, you must wear a gown. You must gown up. You got to protect yourself. That's the new thing CDC has came up with. So you will not know that if you don't have continual education. If you did not do, I know somebody that did not, that was off for vacation and she took a few months maternity leave and came back. So during the time that new thing was put into effect, she didn't know that. So when she was going out, she said, "Well, got it up for." I said, "Oh, you know what to do." She was, "No, I didn't know that, Princess." I said, "Yeah, they just came up. CDC just came up with this. So now we have to gown up for a patient that has G tube. I have to gown up because there is bodily fluid. It is a procedure. You have to do it the right way. So let's open up to learn our fellow Liberians. There is a program that can help Liberians. Like for me, when I start my stuff, I want to help my fellow Liberians. We could do something they call exchange. Don't think I'm coming to take your job. We could do 3 months. I have doctors that could sign up for nurses to come here and learn for 3 months. But some of us are not even honest. If they bring you here, you don't want to go back home. You know, there are doctors that are willing to train. Like you could train at the hospitals. You could come and learn a lot. And I could come to Liberia. For me, I can come to Liberia anytime. I am a Liberian. What happened? Boom. I am a Liberian. I could come and volunteer 3 months at a hospital and educate my fellow Liberians, and we could do exchange. That's what I want to do. I have doctors where I could tell we could contact other doctors, and we do training. You come to the United States for 3 months, and you go through your training. You learn certain things. You come on the floor. You see how it is done, and you go back home and educate other nurses. We learn. We're supposed to learn. But by the time somebody comes to Liberia and wants to help, or you see them in the house where you say they won't take your job, you go to do medicine. You won't get rid of the person. I want to can't take our job. That's why we are so backwards. We're not moving forward. Why is it that they must take a patient from Liberia to send them to Ghana? What happened to us in Liberia? People don't trust us. So many people dying because the nurses are not even giving the care that they're supposed to give. You dare this boy gave me, I always talk about this. When I went to Liberia 2018, this guy was doing my hair. He told me he lost his son. He sent his son to the hospital. His son had fever. The boy went to the hospital. The nurse just can't get him 2 injections. His son died right in front of him. The next thing the nurse told him was to pack and leave because they needed the room. Where is your compassion? Where is the vow you made before you became a nurse? Where is being careful? A lot of medication error occurs in Liberia. A lot of medication error. In the United States, you give somebody the wrong medicine, you're gonna get written up and left to take your license if there is a habit. A lot of it, there is no accountability. Y'all do it like wrong totally like that person. If I did not know, if I wasn't a nurse, I would have taken the wrong medication. This stop it, Didi. This nurse was about to inject me with medicine that was for somebody else. What if I was allergic to that? I would have died if I didn't have the knowledge. A lot of people die because nurses are not giving the proper care. You people think you are doctors and you're giving injection to somebody that is not even for them. You don't even know the five, the six rights to medication administration. Some of y'all don't even check the right dosage. So even know it's the right patient. If you follow the six rights to medication administration, a lot of people will not die in Liberia. If you're following the rights, the nurses, I'm telling the nurses, I know y'all, some of y'all will take this. I know some of you guys gonna take this personal because a lot of us don't like to take. Let me change you. I gotta change my song. I'll be right back. Come on, let me change you. I'll be right back. Please share the video. I'll be back. Please share it. Let me change you. Yes, it needs to be changed. Come on. Yeah, diaper. Wait a minute. Wait, hold on, hold on. Come on. Sorry. Sorry. Come on. Come on, mommy wants to change it. Don't cry. No, mom. No, mom. You want to sleep? Come on. Get up. No, take a nap. Wait, Devin. Wait. Didi? Didi? You sleeping? Hold on, you take a nap. No. Ay, pee on me, sleeping. Stop it. 13, 14, 15, all right, 16, 17, 18, 19, 20, 21, 22, 23, Let's go press the fire. Come on. Yeah, press the fire. Okay. Oh, sorry, guys. Okay. So, like I was saying, um, when people try to help to share what's they know, we look at it as though they are coming to take our jobs. They want to act like they know so much. They want to show off. But the thing is, we do education here in the United States consistently. You have to be updated um, with what's going on. The state comes. The state comes. So even the where we work, the hospitals, the nursing homes, the clinics, every facility that takes care of humans, the state is involved. And a lot of um in Liberia we are not accountable. Like a patient dies and they get out. I've never heard where they paid like the stories I know of where a person was reprimanded because they gave the wrong medication or because so and so happened. We want to improve in our system, our health system in Liberia. It is so sad that when a person is sick in Liberia, they are sent to a nearby country, either to India, to Ghana, maybe Ivory Coast, maybe Nigeria. They send them out of Liberia. Why? Don't we have competent nurses? Don't we have competent doctors? We do. I'm sure we do. But because the nurses are the one killing, like I said, some of you will say, stop, Devin, stop it. Don't do that. Okay? You don't do that. Some people will feel offended. Some nurses will feel offended. Well, it is what it is. I'm just talking from my experience and the experience of others that were patients in Liberia. People are afraid to come to you for help. They rather travel out of the country. Some people leave the United States and they fall sick. They leave the United States for vacation and they get diarrhea. They run out from common diarrhea. They don't want to stay because they are so afraid that they will come to the hospital and you will not treat them properly. You will not give them an Imodium or something to stop the diarrhea. You probably will give them something else without even doing a blood work. Without even like assessing them correctly. Some deaths that occur in the hospital could have been prevented. Some deaths that occur in Liberia could have been stopped. You giving somebody that diabetic drips, glucose, carry the sugar how they go in coma. So the person to they dead. But you as a nurse, are you being thorough? You as a nurse, are you doing the right thing? It's not always about money or because you are in charge. It's not about being in charge. It's about saving lives. The reason why we became nurses is because we want to. Oh, Devin, stop it, please. It's because we want to save lives. That's why we became nurses. Some of us, for those that have the passion, I'm going to put you there if you don't behave. That's why some of us became nurses. So I'm just talking to my fellow Liberians. I know some nurses will get across this, they will feel offended. They will say I'm in the United States, I'm talking, but I'm talking because I've had the experience in Liberia. I'm talking because a nurse did not know the right patient. She was about to give me the wrong injection. I'm talking because I've seen how doctors talk to patients with no respect. Sorry, guys, my son just turned everything off. Hold on. I'm gonna put you down. I'm talking because go dance, go dance. I mean, liking his yeah, you gotta go. You want to dance? Mwah. Yeah. Say bye bye. Say bye bye. Say bye, cause I'm about to strap you up. Okay. Okay, leave this. You put your pacifier. Yeah. Take a nap, okay? Okay. Sorry, guys. So I'm talking not because, and like I said, I know people will feel offended. They will say, "Oh, she American, she talking this," but I'm just talking because, as a fellow nurse, I've heard a lot of negative things. I've heard a lot of dissatisfaction with Liberians that have left Liberia, that went to visit and did not like the that went. Don't throw that down. That went to Liberia and did not like the way things were done. And those nurses could really help our country, but they do not desire to because of the way our fellow Liberians treated them or accepted them or welcomed them. So this message is just a loving message to the nurses in Liberia. When we are talking to you guys, it's not that we hate you all or that we want to act like we know so much or that we are trying to belittle you or to act as if you don't know what you are doing. No, it is just to encourage you. The Bible says iron sharpens iron, iron sharpens iron. So boy, we are toy. The Bible says iron sharpens iron. That means iron and iron makes one sharp. The same thing will make it better. Same thing. Iron sharpens iron. That means you will learn from somebody of your kind. A nurse can help another nurse. A doctor can help a doctor. A mechanic can help a mechanic. You teachers, a teacher before a doctor teaches you. Mostly they were doctors before. So they're gonna teach you the right things. So don't take this as an offensive video because I know some will look at, oh, who is she to talk to us? This is not a video to this is not a video to degrade the nurses in Liberia. No, that was not intended to do so. It's just that I want us to open. Shh, Jimmy, stop. I'm gonna put you to sleep. It is not to degrade nurses. It's just that there are nurses here that want to come Liberia to help. But the way we look at our fellow nurses, instead of giving them love, we look at them as if they want to take our jobs. Nobody in their right mind will want to leave all the money in the United States to go to Liberia. If a person wants to do that, it's because they have a passion for Liberia. Because we make a lot here. It's because we love our country. If a person volunteers to come to Liberia, it is not to take your job. If a Liberian comes there to work and they show you the right way to do things, don't get upset and say she wants to show off. Stop it, Devin. That she wants to show off, he or she wants to show like they know so much. No, it's just that they see that the way you are doing certain things, we have. Come here. It is just to show that the way you are doing certain things, we have upgraded from there. We are doing things in a modern way, like the syringes to draw blood and stuff like that. It was a whole big needle that came to draw my blood with. I was scared. We have updated materials. The thing is, oh, you threw up. Come on, I'm happy. Okay. Hey. So it's not like they are trying to take your job or want to act like they know so much. No, it's just that they want to educate you on how we do things now, modern ways of doing things. Like test a patient. When a patient comes to you, don't go the shortcut. Don't just assume like my channel. I have my foundation. I put it up here. I have my page where it will be intended to speak on some medical things. Like don't just go because in Liberia we suffer from typhoid fever and malaria. So everybody that comes to you, they have typhoid fever or they have, don't do that, or they have malaria. You know, I want you to be a thorough nurse. We want to come to Liberia and trust our system. It's sad that people have to leave Liberia to go to Ghana because they don't trust the same system. But if we, the nurses in Liberia, are doing the right thing, are taking care of our patients, are respecting our patients, people will not leave Liberia to go to Ghana. If a Liberian is treating me the right way, a nurse is caring for me and not giving me the wrong medication for me to die. All right, get there. If a nurse is, let's not close it. If a nurse is a good nurse, I know she's treating me like I to do, or a doctor is taking good care of me when I fall sick, I'm not going to travel somewhere else because I know I receive a better care in my country. So let's open up. There are people that want to come to Liberia to educate, but they are so afraid because our hearts are not clean. By the time somebody wants to help you out, you feel like they want to show off, they want to act like they know so much, and they want to take your position from you, they want to take your job from you, they want to do this to you or that. No, not everybody want people job in Liberia. We are settled here. But we come because we want to help our country. And I'm only talking because for me, I will come to Liberia. I'm going to have my hospital and my clinic. But I'm talking about other people. Until then, there are people that are currently willing to help Liberia. There are doctors that are willing to come and help, but we are not willing to embrace them. Some of us are so corrupt. There was this to do. Somebody was trying to help the common stuff they wanted to do. This group of people charge so much for something that is so cheap. Somebody coming to help your country, you carrying the price up. That you know that's not even the price for certain things. They're not even from Liberia, but a foreigner wants to help you. But because you know the foreigner, you times the price 4 times what is the normal price. How will we improve in Liberia when we're not honest? There are organizations that want to bring medical supplies. Hello? I don't know. I'll call you back. All right. There are medical donations. Do you know how many organizations in the United States that want to help? But the people in Liberia are not honest, so they don't want to help anymore. They want some of us to go there. But this is my thing. Even me, if I come and connect you, are you honest to receive the connect? You're not honest. Are you honest? Common medication in JFK, you're stealing the medication and sending it to your homes to treat patients at home. You're not honest. So many donations come to Liberia until the people don't want to, they don't trust because nothing comes out of it. Nothing comes out of it. They want to help. But instead, the nurses are so rude. So there's some nurses, I'm not going to say all because there were some nurses that were very nice. There were some nurses that did have the passion for their patients. So I'm not going to say all. This video is for nurses that do not care for their patient, that are very dishonest. This is for healthcare workers that only care about the money or the position because they are doctors, they don't have respect for the patients. Because they are nurses, they're in charge, they don't respect the patient. This video is for you. And I don't care how y'all take it. I'm not here to bash. I'm not here to degrade. I'm not here to insult. I'm just here to educate. To educate us. I don't want to live in the United States for the rest of my life. My friends that know me, they will tell you, I love Liberia. I left Liberia when I was 8 years old. But the times that I went back after to visit, I have a passion. I have my foundation. I don't know people. I pay people rent. I pay people school fees. I take people's children and care for them. That's what I do. With my own money, nobody giving me help. Nobody doing anything. But I just feel like if this is where I'm from. Even when you know me as a friend, if you are my friend, I want the best for you. If I'm in school, I will encourage you to go to school. That's who I am. I want the best. And there are some people like me that want the best, but they are so afraid to help. They don't even want to come to Liberia for vacation because we are so corrupt. We are not honest. Somebody say you money to do certain things, you tax them up. They say you money to build their homes. You take the money. You don't even build what they're asking you for. They say you money to do business. You cannot even give the money back. You're not even trustworthy, and we want to come home. I don't want to be in America for the rest of my life. I could retire here and live a good life, but I wouldn't feel fulfilled. I wouldn't feel accomplished. I'm a woman of God. I'm a prophetess. God has called me. But part of my calling is being a nurse. That's my passion. I love to care for people. I have friends. I want to come for vacation. I have so many nurses and doctors that I'm encouraging to come and take a vacation with me. Come on, you will like it. But the corruption among the nurses, the stealing, they could help. Do you know that if like they want to invest, like some of my co-workers would tell me, Princess, let's open a group home in the United States. Let's open this in a nursing agency in the United States. They trust me to do that. Why can't we open it in Liberia and create employments for people? I could encourage them to do that. But if we are not there, can we trust you to do the job? Can we trust that the medication here will come back we come back to the United States? You people will treat the patients. You people will give them medicine. You will not sell the medicine finished because you sold it or you stole it to take care of your own people at home. Can we trust that when our patients come to you all, you render them the proper care? Can we trust you? We want to trust. I want to trust. I want to build a clinic in Liberia. I want to build my foundation. And I have people. I have my doctor. My instructor is a doctor. America has a lot of immigrants. It was immigrants that built the United States of America. Immigrants. So immigrants can also build Liberia. And the Americans embrace immigrants. I mean immigrants. They embrace us for the knowledge. But we do it our own selves. I want to come, like I want to do this program. I even want to come and do awareness, and we have seminars with nurses, free food, free education. You come and you learn what we learn in the United States. That's what I want to do in Liberia. That's what I want to do. Bring my doctors. Vacation. They take vacations, they go other places. But you know how fulfilling it is for a doctor to come to Liberia and volunteer their services? Will we embrace them or we hate them? So they won't come take our job. Can they trust you? Because if I bring some of my doctors and nurses, they will want to help. They will want to establish. America is like a circle. The money goes right back to the government. People want to find another way out. So if a doctor and a nurse want to come, a doctor and a nurse decided, okay, Princess, show us people that we can work with. I want to have a practice in Liberia. Can they trust you? Can y'all be trusted? Please. The value made to be a nurse or a doctor. Please take care of the patients. Please be honest. And when we come to our country, it's not to take the jobs from you all. When we come, it's to help, it's to educate. There is a program that this program brings nurses, brings students to the United States. You could come. Even in the same Liberia, the NCLEX. Y'all could take the NCLEX there and come and work in America. Even if you want to live in America, you can come and live here as a nurse. They will treat you to do education. So you go back home and help your country. We could do exchange. I could talk to some of my people. We do medical staff exchange. Even the government could help do that. Not to get their own family people to come here. There is a program. You come, you do your clinicals, you learn a lot, and you go back home and help. Okay, guys. So this is not a hate video. You can share it. This is a loving message to my to my colleagues in the healthcare, nurses, doctors. This is for all of us. Let's open ourselves to learn from others, to embrace foreigners, to not only foreigners but us. I won't say foreigners, we can embrace from foreigners as well, but let's embrace our own kind. Those that have traveled out of the country, be it the United States, China, wherever they went to get education, let's embrace them. Let's not think they're coming to take our jobs. Embrace them and learn. If somebody that came from China learned some kind of medical stuff and it working with me, I will be so happy to learn from you because you stepped out and learned something that I don't know. I will learn from you to improve myself. Okay? Follow me. I'm Princess Moore. This is my page, Prophetess Princess Moore. And I also have my um foundation page where I talk about medical conditions. I talk about basic things. It's called Desiree Healthcare Foundation on Facebook. Follow me. I put topics there. Sometimes I do give away and I will post it for people to follow and I help people out. I do a lot of different things. But just stay connected, okay? God bless you all. Say bye bye to everybody. Bye bye. Say bye bye. Okay. Say bye. Bye bye. Okay.